Dr. Andrew Weil explained it best when he described America's healthcare system not as a healthcare system, but as a disease management system, one that depends on expensive drugs and surgeries that treat health conditions after they manifest rather than giving our citizens simple diet, lifestyle, and therapeutic tools to keep them healthy. Unfortunately, the ultimate goal of this system is to maximize corporate profit, not to help people maintain or regain their health. The fundamental change I would make in today's healthcare system is to rethink how we define and approach the term healthcare, re-emphasize the term care, and in doing so, reinvent and re-energize the primary care provider's role within the communities. Evidence shows that good access to primary care can help us live longer, feel better, avoid disability, and long absences from work. Areas where there are more primary care providers per person have lower death rates for cancer, heart disease, and stroke, and have lower health care costs. The Commonwealth Fund. Having access to and taking advantage of primary care providers will allow opportunities for instilling key elements related to better health, including education, prevention, collaboration, and monitoring. Education on all aspects of health to people across the lifespan is imperative for empowerment of engaged, healthy people living healthy lifestyles. This will lead to prevention of disease and lessen the burden of chronic disease development and management. I would like to make this change because I believe it is one of the root problems to our current crisis. So many of the chronic illnesses that consume our healthcare expenses are preventable. Given the appropriate information by a vested provider, the patient may choose to alter their lifestyle, thus preventing the healthcare burden of high-cost complications and long-term management. I know my suggested change will improve the system because the data already supports it. Primary care is central to effectively treating patients and is related to better population health, which includes lower rates of mortality. An increase of one primary care physician per 10,000 people is associated with fewer hospital inpatient admissions, outpatient and emergency department visits, and total surgeries, advancing primary care delivery. Although parts of the Affordable Care Act focus on prevention at the primary care level, there needs to be a push to entice new physicians to enter this lesser compensated area of practice. The nurse is heavily integrated into the concepts of quality patient outcomes and reimbursement in acute care settings. Sometimes the only difference between high and low quality care provided by a nurse is life or death. There will be continued concentration on quality care as it relates to patient safety and reduction of risk, such as prevention of falls and medication errors, lowering infection rates, and reducing sentinel event occurrence. The nurse should be involved in policy and procedure development, implementation of new programs, and evaluation methods. Nurses are heavily involved with bedside patient care, and everything we do affects the outcome. We must continue to use evidence-based practice for positive patient outcomes and to hold others who are involved in the patient's care accountable. Reimbursements are heavily reliant on patient satisfaction scores. The higher the patient satisfaction, the more money reimbursed from Medicare. Looking at a patient's typical day, they spend more time with the bedside nurse than any other person. We have a direct link to patient satisfaction scores, like it or not. I feel we will eventually interact with patients based on the questions on the survey, teaching to the test, so to speak. The type of nursing care model that needs to be in place by 2020 is a combination of two. I like the primary nursing model because it puts the nurse back at the patient's bedside, mixed with the concept of patient-centered care. With the emphasis on quality, patient outcomes, and reimbursement, the nurse needs to be back at the bedside, providing care with the 6 aims for improvement in mind, which include care that is safe, effective, patient-centered, timely, efficient, and equitable. Finkelman. By merging these ideas into practice, nurses can have a direct role in providing positive patient experiences with positive patient outcomes. There are several key areas in which the organization should consider restructuring to ensure its survival into the year 2020. Nurses must have a voice, so shared governance should be in place. It is imperative to invest in employees, namely nursing staff. Orientation programs must be developed appropriately, focusing on nursing skills and policies in addition to customer service skills. New nurses should have mentors who guide and teach. Lastly, I think the organization should work closely with the community to educate on health promotion, disease prevention, and overall healthy living. Keeping in mind ways to reduce readmission rates, the organization should encourage community involvement by offering a wide variety of support groups and education classes. I think criteria to evaluate effectiveness of nursing care in the organization is complex and diverse. A great manager should know the quality of care that is being delivered simply by observing and listening to interactions between nurses and patients. There are many numerical tools available for determining effectiveness, but they often leave out the human element, which is difficult to measure, but is what has drawn many of us to nursing. By using the 6 aims for improvement with each patient interaction and finding a way to measure the level of each, one could determine the effectiveness of patient-centered nursing care.